Welcome. Today I'm with Iris Turtz, and she's a licensed social worker, and she's been practicing for over 28 years. She has a lot of experience working with people with disabilities. She spent a lot of time working in an outpatient clinic. And for the past several years, she's been working as a medical social worker. As a medical social worker, she provides a lot of home care, helping patients transition from being in the hospital to being back in the community and back at home. So Iris is going to share with us what that's been like and how the use of technology impacted her work and how it was helpful to her clients and possibly how they had challenges with it. So Iris, thank you so much for joining us today. I really look forward to hearing what you have to share with us. In working with, as a medical social worker, which I find very, very interesting because the interplay between physical health and mental health is so important, and we're finding more and more out about that,
Yeah.
and how it's, we're much more effective when we have integrative behavioral health care with physical health care. So if you could kind of just share what that work was like, providing home care.
Home care has been really exciting and rewarding because you're seeing the person in their actual environment.
Mm-hmm.
And when you see the person in their actual environment, you're able to help them with different things. When they come out of the hospital, especially, they're in shock, basically,
Mm-hmm.
and they don't know what they're going to do because most of the time that people come out of the hospital, they come out not in the shape that they went in.
Wow.
Um, so they have less capable, less able to do definite things around the house, to maintain different things. A lot of times they get out and they're not able to drive. And that's a basic skill. It's like losing your legs in a way, is that you can't have your mobility the way you used to.
Mm-hmm.
And it's pretty traumatic when they get out.
Mm-hmm.
And they don't know where to start a lot of the times in terms of getting help in the house. Will they get back to their normal selves after a stroke or after, cancer treatments or whatever they have? I've dealt a lot with the senior citizens, and as they're losing their skills, um, how do they cope with that?
Mm-hmm. Yeah, I actually just had that situation in my family,
Mhm.
with some family members, and it was really distressing
Yeah,
and really put them into kind of a really down mood. And like you said, not being able to drive was a huge thing.
yeah,
And then knowing how to navigate the system, what's available, how to actually obtain the services and when, and what's allowed, what's not, and was not only confusing to those that
mhm,
were in the situation, the patient, but to the family as a whole.
yes,
That transition was really big, and when we'd go to doctor's appointments, you had the sense that the doctors didn't fully understand, like, what is life really like for this patient
right.
at their home.
Mhm.
Can you give some examples of where actually seeing their home environment made a difference? Whereas if you didn't see their home environment, it would have been missed, and they wouldn't have, gotten the care that they needed, or maybe they would have just ended up back in the hospital because things at the home were missed.
Yes, there's been a number of people that have gotten really far in their own lives. It's exciting to see that, and that
Hmm.
people in their own homes. They've had children. The children grow up, move out of the house to different parts of the country or other countries even.
Hmm.
And there's been a lot of them that don't know what to do. All of a sudden, their children are so far away that they can't help them. The children
Hmm.
can't leave their jobs and they can't help them. And yet they have these big houses to keep up, or, what do you do with that? In terms of home care, aid services, people coming in, they don't feel comfortable about that. A lot of people have too much at stake to lose to get Medicaid services. And, they haven't really planned as well as they
Hmm.
should have for, like, oh my God, the worst that could happen is death. But there's a lot in between that.
Hmm.
And,
Yeah.
um, and to do something with like them, like seeing their houses and saying, okay, you have an extra bedroom here. Would you be do you think that you might want to have someone come and live with you?
Yeah.
A college student or someone for reduced rent out a room.
Yeah.
And a lot of times they're like, oh my God, I didn't think of that.
Yeah.
And several of those have become really successful in,
Ah.
informal mechanisms. But when you're coming out of a hospital, unless somebody says, well, you've got all the space, or you've got all these things, you've got resources, how about using your own resources to your own benefit?
Right.
And
Yeah.
um,
Yeah. And sometimes hearing it from a medical professional,
yes,
allows them to see it as a true possibility, true option for them.
most
Uh,
most people have not thought of that, and that's not something that financial planners have
right.
up. Um,
Yeah. Yeah. Certainly. And so, with the availability of technology and the mobility and transportation limitations that patients often have,
mhm.
how has the use of technology been helpful to you and what you provide and to the patients that you've served?
Okay, there's been a number of people, they want me to talk to either a friend that works or a son
Hmm.
or daughter, and they work. So I'm able to provide for them that I would call them at 6 o'clock when they get home from work,
Hmm.
or whenever it would be, rather than try to meet them, having to have them take off time from work. Um, or to go from other ends of the country even to come to their house to visit them. The
Hmm.
technology has really helped in a lot of ways to do that.
Yeah. Yep. Certainly. So yeah, you've used the phone quite a bit with
Yes,
patients and their families.
yes,
Okay. And because actually going to see you, going to a facility, right, for consultation, simply is not possible for a lot of patients. Is that right?
yes,
And yeah. And then for you, how is it helpful for you? I'd imagine, it really cuts down on your travel time and being able to fit in,
yeah,
the amount of patients that you do make contact with throughout the day to get them the services that they need.
yes.
Uh,
It's a tremendous help to be able to just call somebody and not have to go, because there are people on both ends of the county that I see,
mhm.
in the agency where I was working. I was the only social worker there.
Mhm.
This is mostly nurses, PTOT, and speech that go
Mhm.
out there to the homes. And in a rural community where in some places there weren't even paved roads. And
Uh,
um, to get to these places was very, very difficult. And it really helped with a lot of different things.
yeah. And with video conferencing, you can see the home. So, like as a mental health professional myself who provides psychotherapy through video conferencing, like I directly experience the benefit of being able to see my client's home environment.
Yes,
There's things I would not have been aware of if they just simply came to my office. I'm not aware of their environment. And then, especially for like family sessions,
Mhm.
It just makes it easier because the family's there,
Yeah.
rather than everyone trying to come in, and often they're just not willing to do that. So it's really had a big impact on my practice. And then for the physical health side, like even physicians and the care team.
Mhm.
So like when you do home visits, I'm sure it's like one clinician's going out. Whereas with video conferencing, you could get a care team into the home virtually, which, or even if one care provider's at the home, but
Mhm.
the other care team comes in virtually through video conferencing. And then for the client to be able to see the clinician's face is really comforting in of itself usually.
Yes.
Um, so I think I've heard from you that the organization that you were working for has not implemented video conferencing as of yet.
No.
Um, yeah, but that's something you as a clinician, having the experience that you've had, that's something that you are planning on integrating into your practice. Is that
Yeah.
right?
Yes.
Yeah. How would you see that as being a benefit with the, home health services, having video conferencing as an option?
It's a tremendous thing, as you were saying. If you could get other people in the room.
Hmm.
A lot of times I meet with a full family.
Hmm.
Um, I would coordinate with the whole family. So you see the family dynamic, and you could see what would most likely be, if one of the children said, okay, I'm going to have to move back home to take care of my mother or something
Hmm.
like that. And you could see they really resent it. It's like not a good idea.
Yeah, you can see the body language, right?
Yes.
Yes, yes.
Yes, and things like that. So I'm looking forward to starting things like that to be able to see that, and I could, um, recommend different things rather than or present different things. Like, okay, it sounds like you really don't want to do this in terms of leaving your job and
Hmm.
moving back in with your mom. How about getting some aid to live in one of the rooms that are empty, or
Hmm.
or
Yeah, yeah. I wonder if also like in the home health services,
Mhm.
like when you said recommend things, do you recommend like, hey, maybe this kind of walker would be better than the walker you're using now, or maybe setting up your bathroom this way with these handrails or something like that would be helpful?
Yes, very much so. Very much so. We go over different equipment that's available either through Medicaid funding, if they have Medicaid funding, the LMS, the long-term home health care program through Medicaid is also tremendous. That's a tremendous help. But a
Hmm.
lot of people have been kind of not eligible for it, or it would cost them too much because they have what they call a Medicaid spend down, and it could cost them over $1,000 per month to get the Medicaid insurance. So
Uh-huh.
it's
Yeah. Yeah. So I was just thinking, like, I wonder if, being on video conferencing, showing them some of the things that you're recommending would be helpful. Where right when they're with you there online, they could, see them visually. So like right now, I'm going to pull up an image.
mhm,
Like I wonder if doing such a thing as this. So say you're online with a client and you simply, you know, share your screen and then they could see like we could see now, right? Here's the walker.
that would be fantastic.
And if you wanted to show them like how to design their bathroom and handrails and stuff like that, you just pop it up on the screen to show them. You could even demonstrate things to them, like if they're saying I'm having a hard time, or even if someone at the home is having a hard time transitioning someone, or they're having a hard time transitioning, actually demonstrating through video conferencing, showing them, make sure you're pushing down with your arms. I see that you're not,
Yeah,
using your arms, and uh, so. And rather than, well, you're having an issue with that, but we won't be able to come to your house for until next Wednesday, right?
yes,
By
yes.
that time, they're gonna fall.
Well, the scheduling with that is also a problem because they have no
Yeah,
appointments followed up, and you know,
yeah,
a lot of times those doctor's appointments are all over the place.
Ah, yes, yeah. And as a social worker, was part of your job as the social worker care coordination?
Um, I would recommend it back. They have nurses that are now given case management responsibilities.
Oh, okay.
So what I would do is recommend back to the case manager or the care coordinator,
Mm-hmm.
or if they are already in a long-term care program, to call the insurance company that they're with and say, okay, this is a need, and we need a referral or a doctor's order to get that.
Mm-hmm. Yeah. Okay. Yeah. Well, excellent. Well, thank you very much, Iris. This has been very, very helpful to get an insight as to, what home health care is like for a social worker, and what's involved in being a medical social worker, where you take the medical view and what their needs are at home, and how technology really could kind of overcome these barriers and get people, help when they need it.
It's also emotional. It's also
Mm,
very emotional. There's
mhm,
some family members that think that their parent or something is going to get better and they can't accept things,
hmm,
or the patient that loses the ability to drive or to go down and up their stairways and have to put
yeah.
a bed into the living room you know,
Hmm.
rather than
Yeah.
you know, it's an emotional thing. And I think, and I'd like to get more active in terms of the actual profession to make
Hmm.
sure that this is covered a little bit more in terms of, and really pushed in terms of a need that as the population is aging and is coming, there's a lot more senior citizens now that are having to deal with these issues,
Hmm.
that social work services are provided not only to deal with the entitlements or that kind of very superficial end of it, but also the emotional end.
Uh-huh. Yeah. Yep. And so now that you just finished up this job of medical social work, and home health care, um, it seems like your specialty is maybe private practice, working with
Mm.
uh, those that are homebound or geriatric population at home, helping them with that transition.
Yes, yes.
Yeah, especially with the emotional side. So that, I could see that being such a needed specialty. So clinicians who have clients who are struggling with that transition in the home,
Yes.
where their abilities are different now, they can reach out to you, Iris, to provide those services to them right there in their own home environment,
Hmm.
and providing psychotherapy through those means. I think that'd be so helpful to a lot of patients. And so clinicians that are looking for you, when you have your private practice running, we will have your information on this video. And what state are you in, Iris? What state are you licensed in?
I'm licensed in New York State.
Oh, okay, New York State. Yep. So those clinicians in New York State looking for help for their clients can think of you for sure. Excellent. Well, thank you very much, Iris. I really appreciate it.
Okay, thank you.
Yes. Bye bye for now.
Bye.